This is the Health and Disease lecture, and today we are going to discuss the epidemiology of human disease. This lecture is going to be a little bit different from previous lectures in that it is much more technical and descriptive. We're primarily going to focus on the fundamentals of epidemiological studies. What are they? How are they conducted? And why are epidemiological studies useful for assessing human variation? I think the answer to this last question will become even more clear once you've read your assigned article for the week. There's a great deal of historical accounts that have gained much attention from epidemiologists assessing the spread of disease throughout the human population. The actual field of epidemiology began in the 20th century when epidemics were rampant in Western Europe. The discipline, or the actual discipline of epidemiology, is defined as the study of how, when, and why diseases occur. So epidemiologists try to see what causes a particular disease, who is most likely to contract a disease or a condition, other questions like why does a condition occur in a particular area, and if it is contagious, then how does it spread? How does the disease spread? Other things are what's the best way to control for the disease. Anthropologists have a different role in assessing diseases, in that they are more concerned with the interplay of this kind of triad that we talked about in the beginning of the semester, this triad of biology, culture, and environment. This is really what we are more focused on for this lecture, that is how culture shapes disease. But for example, some questions that anthropologists could be investigating is how does culture shape disease? How do different activities and social networks between population groups impact the transmission of disease? An example would be anthropologists investigating a Southeastern Asian population that interacts with domesticated fowl and how it impacts their chances of contracting influenza. So this is just one example question of what an anthropologist may be looking at versus an epidemiologist. There is, of course, an interaction between the disciplines of epidemiology and anthropology that dates back to at least the 1950s, when medical anthropologists worked with epidemiologists to understand psychiatric disorders. In general, though, most epidemiologists have a stronger background, a stronger training in biology and in public health. They typically approach their assessment of human disease through statistical analyses and other quantitative types of approaches. And we're going to talk about these heavily throughout the main part of this lecture. On the other hand, the training of most medical anthropologists focuses more on culture and the health-related behaviors of humans within different cultures. Anthropologists rely on qualitative methods. They look at ethnographically understanding the disease of particular cultures. So while I want you to recognize the differences between these two disciplines, also keep in mind that oftentimes these differences between the two disciplines actually work together to provide the best assessment of disease in the human population. So for today, we are going to cover two major areas of discussion. First of all, I want to discuss some fundamentals of epidemiological research. Here we are going to discuss some terminology, and that in comparison to other lectures, there's going to be a great deal of terminology in this one. but we will also look at how diseases are classified and the various recognized modes of transmission for diseases. We will then move on to the second portion of the lecture, where we will discuss epidemiological data. How are epidemiological studies conducted? How are they designed? What are the different types of epidemiological studies? So we're going to discuss the various categories of studies, and I'll also just provide a very brief example for each of these. So as I've already stated, this is quite a bit different lecture than your previous lectures, and that it's going to really be kind of the basics to get a good understanding of what epidemiology is, so that you can then read your research article and kind of grasp it in a better way. We are going to start with some basic terminology. The most important terminology for epidemiologists are infectious and non-infectious disease. Infectious disease is often referred to as communicable diseases and is caused by specific infectious agents or their toxic counterparts. Infectious diseases are recognized as those that can be transmitted from one person to another through the agents or toxins. This can be directly and this can be indirectly passed from person to person. Many infectious diseases are also understood to be acute and relatively short-lived. However, keep in mind that this isn't a criteria that can be used to separate infectious diseases from others, as there are definite examples that are recognized as chronic, things like AIDS or TB. However, more often than not, many infectious diseases are acute and they typically have a short duration. Non-infectious diseases are those that are that have an environmental or genetic cause. These include most kinds of cancers and genetic diseases, things like Tay-Sachs or sickle cell anemia, which we've talked about this semester. It can also include nutritional diseases, like vitamin D deficiency or iron deficiency, and it does include allergies. What's interesting is that a lot of conditions that were once thought to be non-infectious in origin are now understood to be caused, or at least strongly influenced, by infectious organisms. For instance, many viruses have been implicated in the development of many different types of leukemias. And another example of this is the human papillomavirus HPV, which has been linked to cervical cancer. So the boundaries between defining infectious versus non-infectious diseases has become blurred through the years, because oftentimes something that was thought to be non-infectious through lots of various research and epidemiological studies it will become evident that it is in fact some type of infectious toxin or infectious organism that is contributing to it. Just to give you more examples of non-infectious and infectious diseases, I wanted to show this chart, and you're going to notice that non-infectious diseases are all of those that are not related to some type of infectious organism or toxin. There are many different causes for non-infectious diseases, but it's often the case that the disease is caused by the interaction of two or more of these causes. So keep in mind that even though a disease is currently viewed as one that is non-infectious, this doesn't mean that, as I said previously, that in the future there will be an infectious cause for them identified. which has happened a lot in the past. But for the most part, though, you can see that many non-infectious diseases are related to environmental factors, while infectious diseases are due to some type of toxin or infectious organism, whether this be a bacteria or some type of virus. This is a table that shows various risk factors that can influence the existence of infectious and non-infectious diseases. Obviously, this is variable, and the concept of risk will differ according to who you are talking to. For instance, whether you're talking to a doctor versus an individual in the population. Risk factors are divided into those that are considered to be host factors, which are particular to an individual. In other words, these are things that are related to differences in age, sex, culture, or the individual's underlying level of health. The other category of factors are environmental. So these are the risk factors that are related to environmental differences. Differences in water quality, maybe actual density of the population, whether people are in overcrowded situations. It could be different levels of sanitation. So there are different sort of levels of how we define diseases in a population. So when a disease, whether infectious or non-infectious, is present in a population at a relatively constant level at all times, it is referred to as endemic. The term endemic refers to this occurring in a population typically at low levels, usually at low levels. When the number of cases increases above the expected normal level, then the disease is said to be epidemic. So then the extreme of this is when the number of cases occurring worldwide suddenly, very abruptly increase, then the disease becomes what we refer to as pandemic. The total number of cases of disease in a given population during a particular time period is referred to as the prevalence of the disease. The number of new cases during a particular time period is referred to as the incidence of disease. So we have sort of the standard underlying kind of normal numbers, which is your prevalence numbers, and then you have any type of new cases being presented in the population is referred to as incidence. So going back to the last slide of terms, an epidemic or pandemic occurs when the incidence of a disease suddenly increases. For an endemic disease, there is little or no change in the incidence over time. Prevalence rates, though, can be either high or they can be low in all three of the situations, an endemic, epidemic, or a pandemic. There are also various terms that are associated with the progression of infectious diseases. There are several stages that vary in terms of length of time depending on the particular disease. The incubation period is marked by the time from infection to the development of symptoms, while the latent period is defined as the length of time between infection and the ability to infect someone else. Typically, the incubation period is longer than the latent period and will usually end before you can actually see symptoms occurring. This is why disease can easily spread, because the incubation period, when you contract the disease in your body, will actually take a few days to be impacted by it. will kind of mask any symptoms that you may have, so that by the time by the time that you were even aware that you were infected, you've likely passed it on to someone else already. So it's also interesting, though, that oftentimes, depending on the disease, the infectious period may end before symptoms disappear. So in other words, the individual could be portraying symptoms but no longer actually be able to pass the infection on to someone else. So the end of the latent period signals the beginning of the infectious period, while the end of the incubation period signals the beginning of the period of symptomatic illness. Sometimes a person may enter a state of immunity as well. This can be temporary immunity or permanently at the end of the infectious period. And another thing to keep in mind that's not evident in this figure is that death can occur at any time during this process. There are two recognized modes of transmission for infectious diseases. Direct modes are those where transmission occurs directly from one primary host to another. The most familiar direct mode of transmission is respiratory transmission. This is when infectious organisms are spread through the air, whether through coughing, sneezing, or maybe even just breathing. It only occurs if the person is in a close enough contact with an infectious person to breathe those droplets released by that person. This, of course, is directly related to differences between cultures, simply because respiratory infections are more likely to occur when large numbers of humans live in close association with one another on a regular basis. There are also some diseases that can be transmitted from a mother to her unborn offspring. This can occur either in utero or at the time of delivery. This is referred to as vertical transmission. When these diseases attack a newborn or an unborn fetus, they will often be fatal and can sometimes impact the child indefinitely. For instance, if a mother contracts rubella during pregnancy, the child will be born with what's called congenital rubella syndrome. This has a number of symptoms, including blindness, deafness, and mental retardation. The other mode of transmission is referred to as indirect. Indirect modes include an intermediate host or agent to facilitate transmission between hosts. These intermediate agents can include things like needles, it's maybe through a vaccination, maybe through drug use. It can include water, soil, or food, which is often shared among individuals. These can also include living vectors like mosquitoes, ticks, fleas, lice. So one thing we have talked about this semester is malaria, which is transmitted through mosquitoes. So this would actually be an indirect type of transmission of infectious disease. Now that we have covered some of the basic terminology of epidemiological studies, I want to now move into a discussion of the data, methods, and applications within epidemiology. There are currently two sources of existing epidemiological data. The first source is that of vital statistics on morbidity. Vital statistics is defined as the systematically tabulated information on the number of vital events in a population. So this is going to include births, deaths, marriages, and divorces or separations, and is based on official registration of these events. Obviously, epidemiological studies wouldn't be possible without knowing this type of information for a population. The earliest evidence of the actual collection of this data began in the 1500s in Western Europe. And we don't really see it in other parts of the world until the mid-20th century. The earliest types of registration for births, deaths, and marriages, though, comes from church membership records. But for the most part, today, these records are now kept by the World Health Organization, or the WHO. The other type of source of epidemiological data are surveys and surveillance. Surveillance is defined as the regular and ongoing collection of data on the occurrence and spread of disease. I'll say that one more time since it's not on this slide. Surveillance is defined as the regular and ongoing collection of data on the occurrence and spread of disease. So these are usually large-scale surveys that are conducted typically by the CDC, which is the U.S. Centers for Disease Control, and the WHO. The CDC focuses on diseases here in the U.S., while the WHO tracks diseases throughout the world. So as you can see, the current data is not collected by epidemiologists, but it's rather usually a product of nurses, doctors, and sometimes religious authorities who are responsible to properly collect and record the data on appropriate forms and submit those to the appropriate agency. This also means there are areas for sources of error, and also there are regions of the world, keep in mind, where records are scarce and the recordings of diseases or epidemiological data just doesn't occur. So for any type of epidemiological study, the quality of the data must be taken into account before beginning any research on particular populations. There are two major types of epidemiological studies. The first is an observational study. You can see here on the left. This is kind of self-explanatory, but this is a type of study that relies on careful observations of the development of a disease, or observations of the presence or absence of specific risk factors. Observational studies can be further divided into descriptive studies or analytical studies. Descriptive studies are concerned with identifying and describing the risk associated with disease and/or the exposure to disease. So these types of studies do not have any specific hypotheses that are being tested, but they primarily serve to, they're only concerned with describing what exists, hopefully generating hypotheses that can be tested. Analytical studies are concerned with the actual analyzation of data to investigate whether associations between exposures, whether there are associations between exposures or different risk factors and disease. So analytical studies are those that are actually testing specific hypotheses. The other type of epidemiological study are experimental. You can see here on the right. And this is when the researcher will manipulate one or more risk factors to see how it impacts the development of disease. So you can see here that these two major types of studies, observational and experimental, produce different types of research. Ecological, cross-sectional, cohort studies, or case control studies. So what I want to do is briefly describe each of these types of studies to kind of end this lecture. So we'll first start with ecological studies. Ecological studies are those that focus on groups or subgroups, which is here referred to as the ecological unit, rather than focusing on actual individuals. The end product of this type of study is one that provides summary measures of exposure and disease for each group under study. So an example of this would be a study that assesses the level of sanitation in different parts of a city to perhaps see if or how it is related to the prevalence of diarrheal illnesses. So one important thing to keep in mind about ecological studies is that the finding for a group cannot be applied at the individual level. In other words, one can't assume that if there is a group correlation between level of sanitation and prevalence of illness, that this means that all individuals in one group follow that same pattern. So not every individual that lives, for example, in a poorly sanitized neighborhood would portray a diarrheal illness. So the value in conducting an ecological study is that it can reveal potential patterns or relationships between risk factors and disease. Cross-sectional studies are those that assess risk factors and disease in an entire population at one particular time. In other words, it's like taking a snapshot of a population at that time. An example of this would be the CDC's National Maternal and Infant Health Survey. You can see how it's typically abbreviated here. This was conducted in the year 1988. This was a survey administered to mothers who experienced live births and also mothers who experienced stillbirths during that particular time period, the year 1988. The study was designed so that factors related to poor pregnancy outcomes could be assessed. So this is essentially, a cross-sectional study is essentially helping to identify any risk factors, or what are the risk factors for a particular disease. Or in this example, they are investigating possible risk factors that are associated with poor pregnancy outcomes for that particular time period, the year 1988. Cohort studies. A cohort, first of all, for those of you that don't know, this is referring to any group of people that share a common characteristic or interest. For these types of studies, a cohort is divided into two or more groups. Most commonly, there are two groups. One that consists of individuals exposed to a factor thought to be related to a disease under study, and the other group consists of non-exposed individuals. So let's just use the NIMHS again, the survey of mothers and infants conducted in 1988 by the CDC. If we were conducting a cohort study, then we would assess the disease of infant death by studying the women in two different groups: those that had adequate prenatal care and those that had inadequate prenatal care. These two groups of women would be followed over time, and the incidence of death for the infants would be recorded. So if the factor of prenatal care is at all related to the disease of infant death, then more people within the second group would show higher exposure to the disease. In other words, there would be higher occurrences of infant death in this particular group. One of the biggest issues with this type of study is that it's long-term. So lots of times in these long-term types of studies, you lose the people from the study. They may drop out. they may move away or something like that. So it doesn't give you an accurate assessment throughout time always. All right, another type of study is case control studies. So in case control studies, these are essentially set up opposite of how a cohort study is conducted. Cohort studies, remember, use exposure forms for the basis of group membership, while case control studies use the disease of interest as the basis for group membership. So for case control studies, the two groups under study include what we refer to as cases, or those individuals with the disease, and then controls, which are the individuals that do not have the disease. So if a particular risk factor exists, a case control study is set up to reveal this, because the case group should have a higher history of the risk factor, or it should occur significantly more in the cases group than in the control group. So for example, if we were to assess diabetes, we would have a case group of individuals that have been diagnosed with diabetes, and then we would have a control group of individuals that have not been diagnosed with diabetes. One risk factor may be obesity. If it is a risk factor, if obesity is a risk factor, it would make sense that we would observe it more in the case group than in the control group. So the primary purpose of case control studies is to identify potential risk factors that are linked with a particular disease. The last type of study is randomized trial studies. These are most often used in experimental studies. Here, individuals are put into groups randomly, creating groups that don't vary in their underlying characteristics. So the groups are then treated differently, and the reactions to treatments are observed. So an example for this type of study would be looking at the effectiveness of an influenza vaccine. Two groups would be created randomly, and both of those groups would be exposed to influenza. The only difference between those groups is that one group would receive the vaccine and the other would not. The value of this type of study, a randomized trial study, is that it will hopefully reveal how the development of a disease progresses under certain conditions or under certain influences. And of course, it will also reveal if and how the disease reacts to the medication or the actual risk factor being tested. So kind of in summary, remember that epidemiological studies reveal differences in disease that are related to a number of things. Not only is diseases related to populational differences, but also cultural differences. And I know this lecture has differed a lot from the others, and that it's been more technical and not primarily concerned with discussing human variation or its relationship to human variation. However, you're going to be reading an article this week that does discuss this relationship of genetic variability to medically important differences in disease. So just as I briefly mentioned in the beginning of the lecture, there are cultural differences between populations, and these cultural differences have likely led to differences in the causes, differences in expression, and differences in the prevalence of various diseases. So this idea of racial and ethnic differences in the expression of various diseases will be discussed in your assigned reading for the week. And all of the details of epidemiological studies that we have discussed during this lecture will hopefully help you to better understand that article.